Good morning, everyone, and welcome to today's session, Mental Health and Wellbeing. This is the third session of our Ready to Enhance Project ECHO series from Ohio Adult Allies in partnership with the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. This ECHO is designed to equip adults supporting youth community leaders with the tools and insights needed to effectively empower youth. Through 5 monthly sessions, this series will address critical topics to enhance communication, foster supportive environments, and build cultural competency while promoting youth leadership and mental well-being. Together, these sessions provide a comprehensive framework for advancing the work of adult allies who seek to encourage youth empowerment. My name is April Schweinhart, and I have the pleasure of supporting this series. Just for some context, and anyone who's new, there's approximately 1,300 hubs in over 200 countries running ECHO sessions, and I am so proud to know that we are the first behavioral health ECHO in the country. So bringing this innovative prevention resource to Ohioans is a pleasure. This ECHO Hub is facilitated by team members from Ohio Adult Allies and the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. You can visit each of these organizational websites to learn more about the work using the QR codes on the screen. Both the Center and the Ohio Adult Allies Initiative are funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation. Whether you're new to this model or you've experienced one of the center's other ECHO sessions, I think it's probably most important to understand the core philosophy of ECHO, which is all teach, all learn. In each session, we'll start with a subject matter expert providing a didactic on the identified topic. But what makes ECHO so special and effective is the core value that everyone in the room, all of you, have the knowledge and experience to make a valuable contribution. And I know that I personally, as well as everyone else, can learn from the work of our community members. Collectively, we know the wisdom is already here. So why do we use the ECHO model? Some of the benefits are listed on the screen, and we won't spend too much time talking about this slide, but I wanted to highlight that this model democratizes information and expertise for the public good, builds workforce capacity, and ultimately improves outcomes for communities. Just some practical tips for today. Please do mute your microphone when you are not speaking and unmute your microphone to speak. I know we're getting close to lunchtime or you might be on a different time zone, but please turn on your camera if possible. These sessions are really intended to build connections and relationships, and that's always better when we can see your shining faces. I encourage you to use the chat feature throughout the session, particularly to share resources or insights. I'm so excited to see people are still joining, which is just fine. It may be helpful to use the raise hand function during the discussion portion of the session, just so we don't talk over each other. And then if anyone has an AI note taker, please be sure to turn that off. If you have technology issues, please reach out to my wonderful colleague, Nancy Clough, who's just put her information in the chat, and she will be happy to help you. As the hub team, we all have our white backgrounds here. We're committed to creating an inclusive environment and providing all necessary accommodations. We promise to start and end the sessions on time and work hard to make good use of your time by providing quality content. The only recorded part of our sessions will be the didactic presentations, and this is out of respect for your privacy and the community members you serve. Finally, we will be providing continuing education credits, which you can earn by completing the evaluation after each session. We also ask for a commitment from all of you as participants. Please help us create a safe and respectful learning environment by valuing the opinion of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping discussions confidential. We encourage you to be open in sharing your experiences. This is a supportive space. Finally, I'd like to remind you about the schedule for our upcoming sessions, which you can also find at the QR code on the screen. This series of Ohio Adult Allies Ready to Enhance meets Tuesdays, and our Advanced Prevention ECHO meets every third Friday of the month, the next of which will be May 16th. With that, I will go ahead and start to hand it over to our presenters, starting with Dr. Kathleen Tebb. Dr. Tebb is a professor at the University of California, San Francisco, in the Division of Adolescent and Young Adult Medicine. She is a developmental and health research psychologist who focuses on understanding how to promote adolescent and young adult health and well-being. For the past 3 decades, oh, you don't look old enough to say this. For the past 3 decades, how impressive. She has incorporated community engagement principles in the development, implementation, evaluation, and dissemination of interventions to improve health and developmental outcomes and advance health policy. Her colleague Peter Mayfield is the founder and director of strategic expansion of Gateway Mountain Center, a youth development organization innovating how youth learn, heal, and thrive. He is passionate about changing the system of care for youth suffering from serious emotional disturbance and complex trauma. Gateway's program, Whole Hearts, Minds, and Bodies, is the first nature-based therapeutic program to achieve full-service partner contracts with the county behavioral health departments and certification as a Medi-Cal provider. This program was recently launched in San Francisco, and Peter is working to spread this method and system to more cities through therapeutic nature solutions. Welcome to both of you.
Thank you so much for that kind introduction. I really appreciate it. And it's lovely to have you all join us for today's session. We have a large agenda with us today, but I think we can accomplish it. So our learning objectives are by the end of the session, we hope that you'll be able to recognize the signs and symptoms of common mental health conditions in young people and begin to learn about strategies for promoting positive mental health and reducing stigma. I'll begin with a little background on mental health, and I certainly don't have to tell all of you that we are experiencing a youth mental health crisis. Nearly half of all adolescents have had a mental health disorder at some point in their lives, and as most of you know, suicide is now the second leading cause of death among adolescents in the United States, with vast disparities. Mental health and substance use often co-occur. Mental health can contribute to substance use and vice versa. Substance use can contribute to mental health issues. And our system is broken. Less than half the youth in need receive care, and those that do seek care experience long delays to treatment and often drop out of care. We also have a vast shortage of mental health providers. The role of social media on mental health has been garnering recent attention, and this is hot off the press from my colleague Jason Nagata. He recently published a study that found screen time in social media is on the rise, especially among early adolescents, those between 9 and 15 years of age. This increased screen time is associated with a range of mental health symptoms. They also found that screen time was associated with sleep problems and also cardiometabolic risk factors, which is really quite surprising. But importantly, parents who spent less time on their own devices and who had rules that restricted screen time resulted in less problematic use among their adolescents. When we think about mental health, the socio-ecological model can be particularly valuable in understanding the complexity of the vast range of influences on development and mental health. There are biological and genetic factors at the most proximal level, that very center of this cycle, that can predispose an individual to mental health issues. However, the strongest predictors extend to the outer levels of influence, including broader community factors, mass media, and policies at the larger culture and society. At the bottom of the model, you see this depiction of time. Factors at each level assert influence upon one another throughout the life course. This includes intergenerational transmission, as well as specific events, such as the pandemic or natural disasters. We're learning a lot more about the relationship between early adverse experiences, toxic stress, and mental health. And what we know is strong, frequent, or prolonged adverse experiences, especially without adequate support, can become toxic. And toxic stress generates excessive cortisol, which can disrupt developing brain circuits both in early childhood as well as in adolescence. And we know that poverty now has a direct effect on brain development through the mechanism of toxic stress. Another macro level factor is social norms or stigma, but it has influences at all level of the socio-ecological framework. They consist of the often unspoken rules of a group that shapes both our behaviors and our attitudes. And I love this framework. This comes from a 2021 systematic review that identified 10 structural determinants or drivers of stigma, which include laws, economic policies, media, social welfare systems, and more. These structural drivers contribute to stigmatizing processes that influence beliefs, stereotypes, prejudices, and labels. This in turn influences the individual's experiences of discrimination and status loss. So let's take a look at stigma around mental health, which contributes to stereotypes and prejudices that lead to discrimination. Public stigma places blame on the individual for their problems. It's as if there's something wrong with that individual. They're lazy. Sometimes they're viewed as dangerous. They may be treated differently by their family, peers, teachers, or employers. Institutional stigma is more systematic, involving policies that intentionally or even unintentionally limit opportunities for people with mental illness. This can include lower funding for mental health services relative to other health issues. It can also influence what types of mental health services are covered by insurance. Internalized stigma can affect a person's self-efficacy, their confidence, which can be a barrier to getting the help they need. And when they do seek treatment, stigma contributes to them maybe feeling shame for getting those services. So it's really important to recognize the warning signs of mental health problems. We want to be on the lookout for sleep problems, changes to eating behaviors, perhaps rapid or dramatic changes in personality or mood. Are they irritable, sad, anxious, show little interest in day-to-day activities? Skipping school and falling grades can also indicate a mental health issue. And of course, talking or even joking about suicide needs to be taken very seriously. And as I mentioned before, substance use is another common red flag. But the good news is that early intervention and treatment can help lessen the impact on their lives. The National Alliance on Mental Illness offers some suggestions about what we can do as individuals to help reduce the stigma of mental illness, including talking openly about mental health, such as sharing on social media, educating ourselves to respond to misperceptions or negative comments by sharing facts and experiences, being conscious of the language that we use, because words do matter. Encourage equality between physical illnesses and mental illnesses, drawing comparisons to how they would treat someone with cancer or diabetes. Show compassion for those with mental illness, be honest about treatment, normalize mental health treatment just like other healthcare treatment options, and choose empowerment over shame. And I really love this one. That means owning my life and my story and refusing to allow others to dictate how I view or feel about myself. And in addition to addressing stigma, building resilience can buffer young people from adversity and promote mental wellness. I could devote an entire webinar on this topic. It's so near and dear to my heart. But in brief, there are three main environmental processes or clusters of protective factors that buffer risk and foster resilience. The first is caring relationships, especially with a non-parental adult. Every study on resilience has identified this as a core factor. Establishing high expectation, which involves fostering belief in someone that they are capable of success, and providing opportunities for participation and contribution, really giving youth voice. These factors in turn improve emotional regulation. They build hope and a sense of purpose and a bright future. They support the development of a positive identity and self-efficacy, and they increase problem solving and social competencies. And with that said, I will stop sharing and turn it over to my esteemed colleague, Peter Mayfield, for a real life example.
Peter, your slides look good. Oh, Peter, you're muted.
Mute. Okay. Thank you. Now I'm here. Thank you so much, Kathleen, Dr. Ted.
And Peter,
All
we
right.
can't see your slides anymore.
Yep. I'm resharing because I
Okay.
had to unmute. Here we go. Okay. Are you able to see?
Can you click it one more time?
Yep.
That's perfect.
Perfect.
Okay. Thank you so much. So 13 years ago, we started this program, Whole Hearts, Minds, and Bodies. We're located in rural Eastern California, up in the Sierra Mountains. And observing how we were supporting youth in the alternative education system. So the continuation high schools and the what's called a community school that the year before we started was called the court school. And observing how these high need youth and a majority in our community of youth in our alternative ed system are disproportionately coming from our Latino community. So when those kids need to see the therapist or the psychiatrist that the public health system provides, they have to go to this building, the county building. They walk in, it's the court entrance, the metal detector, the sheriff. They go up the stairs, they pass child protective services, probation to get to the third floor with a wonderful therapist and or a psychiatrist in a windowless room. And this is somehow we co-locate healing services with law enforcement, and it's incredibly stigmatizing and re-traumatizing. Our program was set up to serve very high need youth. So in the Medicaid system, these would be youth who classify as moderate to severe, juxtaposed with mild to moderate. So kids who are debilitated by their symptoms. And what we built was a delivery system where one licensed therapist can clinically supervise 10 well-trained paraprofessionals who can go out into the community, meet youth where they are. So in contrast to that young person going through that whole gauntlet of law enforcement to get to the therapist, someone like myself would pick up the kid, yeah, the youth from school in the front of the school with a kayak on the car and spend 3 or 4 hours one-on-one exploring the world together. We say our therapy is shoulder to shoulder exploring the world. We came in observing, reflecting on after the first couple of years serving about 90 youth in this one-on-one fashion, reflecting on really what worked, what was effective. We came up with this framework we call Four Roots for Growing a Human. And we strongly believe that this framework is useful across the wide spectrum of behavioral health care for prevention, even youth development. Like I say, we develop it with some of the highest need youth who are, you know, frequent visitors to the emergency department for psychiatric distress. But this works for school teachers to ponder, for community workers to utilize. I'll go into each of these a little more in depth, but four roots: authentic relationship, connecting to nature, embodied peak experience, and helping others. We have some really strong outcome data, and Dr. Teb has been an amazing partner helping us with some of this. But a very notable point is the retention rate. 91% of these kids, youth, and we go from 6 years old to 24 through 24. 91%, if they do 2 sessions, they stay doing weekly sessions more than 6 months, 69% more than a year. Um, Outcome data on the reduction of emotional distress is very significant. And we're comparing these to like traditional therapy and youth of color engaging traditional therapy. And our outcomes are very positive. Hard to measure is tragedy averted, but our community recognizes that. Kids that were coming to the emergency department stop coming. So the hospital contracts us as well, as does the probation department. A little more about our framework, authentic relationship. We love being in this lineage with Dr. Teb, coming from the Kauai study, which he referenced that important point that a consistent, caring relationship with a non-parental adult is key. And we think about how oops, in evolution, adolescence, 3,000 years ago, we lived in these deeply, sorry, my computer is, my slide advance is struggling a little bit. Okay. These these interconnected relationships, these kind of tribal structures, and adolescents really evolved to connect with other adults beside their parents. There's even a study that proved with neuroscience that we at puberty, adolescents downregulate their ability to hear their parents' voice in favor of hearing other adult voices. So we strongly support families to help if their youth are struggling, to connect with other amazing adults. Nature, there's a whole big growing body of work about the health benefits of connecting to nature. We evolved to be uniquely sensitive to this sensorium of the light on the leaves, of the smells, of the sounds. There's all sorts of science about the monoterpene, the molecular compounds coming off trees, building our immune systems. And sorry, my computer is being strange on advancing. I don't know what's happening. Let me try.
You want me to share my slide deck for you, Peter?
Oh, here we go. Sorry. Let me go back to view. I don't know what full screen mode. Okay, so time in nature is very important. We also do this engagement of balance challenge, what we call embodied peak experience. So with these youth, we're actually getting off the trail. We're walking on logs. We're walking across boulders. We're kayaking on a lake, on a breezy day. And there's some really interesting neuroscience to support that activating the vestibular, the proprioceptive, the sensory motor strengthens neurologic connections that strengthen the sense of self. And indeed, many youth who are struggling could be said to have a weak sense of self. In hard cases, even a fractured sense of self. So this weekly balance challenge, um, we really see significant improvements with these youth. And we think this has a lot of implications for teachers getting kids moving their bodies more in schools. Finally, helping others, the meaning making of connecting to community through service is so important. Oop, there's my timer. And adolescents are hungry for this. And this also reduces stigma to like find that belonging, that connection. So that is my presentation. This slide has contact information for Dr. Tebb and myself. And thank you so much.